Chapter 31, Health Supervision. In this chapter, we're going to talk about some developmental surveillance and screening tools for children, demonstrate knowledge of principles of immunization, identify the barriers of immunization, and identify key components of health promotion. Okay, so developmental screenings are ongoing collection of observations, information. They are done as well child checks. They are done when a parent or caregiver expresses some type of concerns. One of the most important concepts of a developmental surveillance is to get that developmental history. Making observations, so oftentimes physicians will have the child jump up and down, whatever milestone that they should be meeting at that point. And then consulting with professionals, with consults with different types of services if needed. The developmental delay is really that child's ability to do things across their lifetime. When a developmental delay is detected or suspected, then they'll do, if it's just suspected, they'll do frequent screenings. If it's detected, then they will make plans for intervention. The earlier they assess and identify a problem, the better the outcome, because they can intervene quickly. Your book talks about some red flags of patients at risk. Patients or infants or toddlers at risk for developmental delays. Obviously, those that are low birth weight, low premature babies. Anybody with types of hypotonia, things like that. Anytime of congenital malformations. And then lead levels, so lead poisoning. Sometimes single parents. I think there has to be more to that than just being a single parent. Sibling with developmental problems, obviously, that they're more concerned about this baby. On table 31.1, it just kind of goes over some of the developmental warning signs that we should just have an idea about. This is a copy of a Denver developmental screening tool. I don't expect you to see it really well, but this is what physicians use for those well child visits or any type of frequent screenings that are needed. So it looks at the psychosocial development, fine motor, gross motor, and then language. And then across the top and bottom, it will go through ages. And so they'll kind of guide what number, how many that they're delayed or meet, and then they'll add that up. So again, that's a very small picture. So sorry, that's the best I could get. The American Academy of Pediatrics recommends that there are developmental delay checks as well as autism screenings. So when they haven't met the milestones, that can be a warning sign that there's something wrong. Could be neurologically, could be that I've seen incidences of kids who are kept in a car seat all the time, so they have no movement, kept in a stroller constantly, kept in a crib, kept in a playpen. So there are kids with developmental delays based on parental actions. And then any child who loses a developmental milestone needs to have an evaluation. One of the examples I can give you was actually she was a nursing student about 8 years ago, and her son was about 2.5. And you remember we talked about them. They kind of have pot bellies and they kind of bowed legs. And so it was walking well, but just started walking into walls and things like that. And she noticed that was a delay. And then he couldn't seem to walk one day. And so she took him in, and long story short, he ended up having a brain tumor. So that was causing the delays. Very good outcome. So identified early, and then interventions. Autism. So autism is a spectrum disorder, so that every child is different. And so making sure that we are consulting with the parents when a child has autism on, what they can and can't do, as well as a physician would during the screenings. But those screenings should be done at least between 18 and 24 months old. And that's for kids who actually go to the doctor. Not all kids go for well checks, so that can there could be delays that we're not aware of. Types of screening, there's a risk assessment. So looking at is a child at risk for a certain disease or illness. Universal screening, so they do that on everybody. And then selective is when there's some type of disorder. So universal screenings will be done at those well checks at especially the 9, 18, 24, and 36 well child checks. It's important because that's when they're going to identify those delays in milestones. You'll go into a lot of the inborn errors of metabolism that are checked at birth. It's mandatory that they are checked, although parents can opt out of it. But Doris will go into some of those. So there's a lot of metabolic disorders that they are screening for. Hearing, we talked about vision, iron deficiency anemia. So we're always screening for that, and lead poisoning, even though we think that there's no lead-based paints anymore. We're still having that issue because there are. Also screenings for hypertension, obesity, and hyperlipidemia. And then this chapter goes a little bit into immunity, so immunizations, the difference between passive and active, you probably remember from microbiology maybe. But passive is when the immunoglobulins are transferred from one to the other, and then active is when you have your own antibodies. Active obviously lasts longer than a passive immunity would. This is a chart from the CDC website, and it is the vaccination chart. You do not have to remember this. If you worked in an area where you gave vaccinations, these would be plastered all over the walls. But if a parent ever wants to know, I'm not, they say, I'm not sure if my child's up to date, you can pull one of these up on the computer and see what they should have. Now, they do give some at birth, so your Hep B is given at birth, but if children are not born in the hospital, sometimes they're at risk for not having that. And then some kids miss vaccinations. If a child is ill, they won't give the vaccination that day. If they have just mild cold symptoms, then they will. But often parents move around a lot, so they miss appointments. They can't get them to the doctor. There's many reasons why kids are not compliant with their immunizations for those type of reasons. And also there's kids who don't have immunizations because their parents don't believe in them. So we still have quite a few of those, even with all the education out there. So, but this is just the chart if your parent wants to see where they should be. Contraindications, there's really only 2 contraindications to the vaccine. One is if they've had an anaphylactic or a systemic allergic reaction to a component of the vaccine, so then that would be a definite barrier. Pertussis immunization, so if they have an encephalopathy without identified cause within 7 days, they would be contraindicated to give them that vaccination. Parent concerns about vaccine safety are a significant cause of why kids aren't getting vaccinated, as well as moving from doctor to doctor, losing records. One of the important questions to ask is, where and when did your child have their last immunization? Instead of, are they up to date? Because parents, it's easy to say yes, but where did they have it, and what was the last one they had? Because that can also give you a guide into what they're missing. And then health promotion. So for health promotion, we focus on giving the parents those tools, keeping the kids healthy, and then that partnership when there is any kind of developmental delays to get access to care. And that's it.